Dr. Eric St-Onge. Welcome to a new series I'm putting together called Kettlebell Sports Science. In this new educational series, I'm going to be combining topics related to kettlebells, kettlebell sport, and sports science all put together. If you're going to use this information that I'll be putting together, I'm certain that this can help increase performance and also prevent injuries all at the same time. Now, without further ado, let's get started. Now, one of the things I want to do with this series actually is to feature a t-shirt that I've collected over the years that has to do with kettlebell sports. So for the first one, I find it very fitting that I put on my World Kettlebell Club t-shirt. This is one of the first ones I ever got, and it was from a certification course that I took here in Toronto back in 2008 of all things, and that was the first time I ever got introduced to kettlebell sport and Valery Fedorenko as a result. So I'd like to say thank you. Now, briefly, what I want to do is actually go over some of the anatomy of our low back and of our hips. So here we have a model to play around with here. So this is our front, this is our back. So here are our actual hip joints themselves. In a regular hip, we have roughly about 30 degrees available to us in a normal functioning hip. In our low back, also called our lumbar spine, we have this normal curvature this way. So we're in a relative extension, which is our neutral position actually. But what happens is if we actually go into more extension here, what's actually happening is that these joints back here, called our facet joints, are approximating, meaning that they're getting closer together. Now, one or two times is not a problem, but what happens is if we're continuously in an extended position, such as in the rack position, what happens is these joints get really angry at you and can cause some injuries here, cause some low back pain, and in some very extreme cases, we can get something called a spondylolisthesis, which is a forward slipping act of the vertebral body. Now that's an extreme case, so I don't think we have to worry about that just yet, but it's something to be aware of. So now that we understand a little bit more about the anatomy, let's talk about how this affects our rack position. So when we're in our rack position, ideally what we want to have is to have more hip extension and less lumbar extension. Because like we just talked about, if we have too much hyperextension in our lumbar spine, this can cause damage in our low back and cause low back pain, so on and so forth. So here's an example of what it looks like if somebody's not using a proper positioning. So if somebody has excessive lumbar extension, we'll look at something like this in the rack position. Now you can see there's a lot of motion in the actual lumbar spot. What if we actually try to limit this lumbar hyperextension and utilize our hips a little bit more? We see something a little bit more like this. Now the change is actually rather subtle, but what this actually does is takes a lot of the pressure off of the low back, puts you in a much safer position overall. Now many, once they first try this, might have a little bit of difficulty actually getting into this ideal position, most commonly because of lack of hip extension. Now, this is fairly common because in today's society, we spend all day sitting down, every day, all day, every day, so our hip flexors tend to get a little bit on the tight side. So for actually getting the ability to get into proper hip extension is limited in most people. So, what do? How do we get more hip extension? It's actually a fairly big question because what person A might need is different than person B and person C. So I can't just give out, this is what you do to get hip extension. What I'm going to share with you right now is a type of flow chart that I tend to use with most people, and you can find the description of that below in the link. The first step in assessing your own hip extension is when we want to test to see if your hip actually has the ability to passively get into extension. So what we're going to do is essentially going into a hip flexor stretch position. What we're going to do here is actually tighten up your trunk muscles so that we actually keep your low back in a neutral position. So when we're doing this, I don't want to see any sagging of the low back. So nice and tight. And what we're going to do is lean the pelvis forward so that we're effectively bringing your back leg into extension. So at the end position here, you're going to feel either one of two things. One, if you're feeling a pinch in the back side of your hip here, that's typically an indication that the hip joint itself is not moving quite as nicely as we would like. And in this case, I would recommend just visiting your manual therapist to get a bit of a closer look at the hip joint itself. Now, and most commonly, the rate limiting factor in this case will be tightness felt in the actual front of the hip here. So if that's the case, and you don't have quite as much hip extension as you would like, then that's a point where you would want to start stretching out the front of the quadriceps here, hip flexors. So let's assume now that when you tested your passive hip extension, the limiting factor was tightness in the hip flexors. So the solution to that is to stretch out your hip flexors. Now, one of my favorite stretches to do is going into a half kneeling position, facing forward here. So what we want to do actually is contract your abdomen here so that you actually give yourself a bit of a posterior pelvic tilt. So you're tilting your pelvis this way. Like that. So, next part is keeping this nice and tight here. You're going to lean forward up until you feel a stretch in your hip flexors. So once you start to feel a stretch in the hip flexors, this is your starting position. What we're going to do now, perform isometric contractions. So we're going to actually squeeze your glute muscle and your hamstrings as well. Just be careful, some people tend to cramp up here, so slow and steady. So we're going to contract your glute, contract your hamstring. Take about 5 seconds to ramp up. Hold that contraction for a good 20 to 30 seconds, then slow it, then ramp down to 0. After that, you're going to contract the opposite side. Contract your hip flexor and contract your knee extensor. So I'm trying to bring my knee up, and I'm also kicking into the floor right now. So you'll feel your quads and your hip flexors here starting to tighten up. So take a good 5 seconds to ramp up. Hold for 20 to 30 seconds. Then ramp down. You might notice after you do this, you'll get a little bit of extra range of motion. That's normal. So now sink into it. And once you feel your new barrier, that's your new starting position. And once you're here, start that process over again. Squeeze the glute, squeeze the hamstring, hold that for 20 to 30 seconds, take another 5 seconds to ramp down, then contract your hip flexors again here. Take 5 seconds or so to ramp up, hold for 20 to 30 seconds, then ramp down for 5 seconds. In total, the longer you can stay in this stretch position, the better results. So holding this stretch for at least a 2-minute period of time while performing those contractions will lead to some of the better increases of range of motion. Now, one of the things that you can do to make this even a little bit more difficult and to bias your other quadricep muscles that don't cross the hip joint is to actually elevate your foot onto a small platform. So starting off the stretch in this position, you might notice that you get a bit more of a stretch or a stretch in a different part of your actual quad. And once you're in this position, the same instructions apply. So squeezing your glutes and your hamstrings and squeezing your hip flexors and your knee extensors and performing them in the same manner as the previous stretch. Step 2 is to see if your hip can actively get into extension. Meaning, can you get into extension by using your own muscles to do it? So the way you're going to do this, just go on a small platform so that one leg is just free hanging here. And again, we start off with a tight trunk. Keep this tight, keep this in a neutral position. Looking straight ahead, what we're going to do is contract this glute here and extend your hip backwards. And really try to be strict about not letting your back sag back this way and cheating yourself. So we're really just trying to test this on our own to see how much we actually have. Now, if we see that we don't have quite as much as we do passively, which is actually normal, but if we see that we don't have enough active range of motion, the next step is to, of course, get more active range of motion. So the way we're going to do that actually is a little bit similar to how we're going to be stretching the muscle. What we're going to be doing here, we do this in a couple of different ways actually. First way is to actually get into that stretch position, like so, and just contract the muscles around the hip. So the first part we're going to do, contracting the glutes, contracting the hamstrings, while remaining stiff in the trunk area. And we're going to hold that contraction, again, 20 to 30 seconds. Relax, then contract the hip flexors. So as if I'm trying to kick out this way, that's the motion I'm trying to do here. And hold that for again 20 to 30 seconds. And repeat that a few times as well, so that you're in this position for at least 2 minutes. Another method that you can use is actually setting back on the platform, bring your leg back and just holding it here. So this makes it just a little bit more difficult, because now we're doing isometric contraction, but again, there's a little bit of resistance because your leg is free floating here. So holding this position here, and 20 to 30 seconds, then relax. Another training exercise you can do is called an end range liftoff. So what we're going to essentially do is get your hip into its end range of motion. Then once you're here, perform a small liftoff and relax. So it's actually, doesn't look like a very intense exercise, but if done properly, it's actually quite difficult. So again, nice and straight here, and lift up. Now we get to the end. Assuming that we have adequate passive extension and adequate active extension, now it's time to put it all together and practice it in the actual rack position. Now I first want you to practice it without kettlebells. So we go here, actually play around, get out of this position, and get into our proper position. The reason why I want you to practice this without kettlebells first is because, in my opinion, if you can't get into a certain range of motion or into a certain position unloaded, meaning without any weight, you shouldn't force yourself into that position by adding weight. In that case, your capacity to bear that load is exceeded, and now you're asking for injuries. So do yourself a favor, get comfortable with this position without any weight, make sure you have the proper hip mobility prerequisites, then only then can you load it up and continue on training. So quick recap, what did we learn today? What we want to do is, in the rack position, we want to promote hip extension and limit low back extension. And this is crucial to keep your back healthy and prevent any injuries from happening in the future. Thanks very much for watching this first episode of my new series. If you like this video, please like it, please subscribe to my channel, and if you have any comments, please leave them below, and if you have any suggestions for future episodes, please, I'm all ears. All right, thanks, bye-bye.